visible and audible? Am I audible?
Yes,
Can you speak
Manjit.
a little
Yes.
louder? Little louder.
Okay. So my talk is on Amsler grid. This Amsler grid was devised by Professor Mark Amsler in 1945. He was a Swiss ophthalmologist. So what we test in Amsler field is only a part of the visual field. That is around 20 degree of the visual field. This classic picture is the trackware hill of vision surrounded by the sea of blindness. In Amsler, with this technique, we are testing only the tip of the hill. So the principle, as you can see here, this is the Amsler chart which we have. We have these charts with multiple square pattern. You can see that it has around 400 squares, that is 20 into 20 squares. The total sheet is a 10 centimeter square sheet, and we have 400 squares in it. So the total one side will certain an angle of 20 degree when the sheet is held at a length of 14 inches. Each square will certain an angle of 1 degree, and from if you consider from the central visual axis, you can see that all around we have 10 degree covered in this Amsler chart test. So altogether you test around central 20 degree of visual field, 10 degree from the center of fixation all around. There are two types of charts mainly, testing charts and recording charts. Testing charts itself are of 7 types. Most of them have a black background with white or red lines. We'll come to it. And the recording charts are in the reverse form. They have a white background with black lines. So these are the 7 types of testing charts. You can see that except for the sixth one, everything is every other chart is having a black background with either white lines or red lines. So chart one, this is a commonly used one. It has 400 squares, a central fixation spot, black background, and white squares. Second one is used for people having poor central fixation. When they cannot fix the central spot, when there is a central scotoma, you use two diagonal lines and ask the patient to look at the probable site of intersection of these two lines. The third one, here you have red lines in black backgrounds. So this is especially useful to detect color saturation or in optic nerve lesions, where the loss of red lines may be better appreciated. The fourth chart, instead of lines, they have random dots in black background, and it's used to differentiate a metamorphosia from scotoma. The fifth and sixth one, they are especially used in patients who complain of metamorphosia while reading. So here you have only horizontal lines, and in the sixth one, where you have a black background with white background with black lines, and you can see that towards the center the lines are more closely arranged. The seventh one, in addition to the first grid, in the central you have a densely packed line grid, and each smaller grid will certain an angle of half degree. So what we commonly use is only the first grid. So this is the recording chart. This itself can be used as the recording as well as the testing chart, and this is the most commonly available type of Amsler grid chart. So how will you do the test? You have you need a good lighted room. Patient should be asked to wear the reading specs and hold the chart at the reading distance, and each eye should be tested separately. The patient is asked to look at the center dot. If we cannot see the center dot, you should draw two diagonal lines and ask to look at the center of the intersection. Then ask him if he can see all four sides. Ask if there are any lines or squares are missing. That means there is a negative scotoma. Ask if they see any dark area on the chart, which indicates a positive scotoma, and look for any distorted lines. That means that the patient is having a metamorphosia. and you ask the patient to draw the abnormality by himself. He may draw an area of dark area in the field of vision or distorted lines. So what's the clinical significance? Generally, it helps to differentiate between a macular disease and optic nerve disease. Macular diseases usually show dark areas or distorted lines. So in the first one, this is a typical appearance in a case of central serous retinopathy. You can see a dark central scotoma. Second one, this is a case of macropsia. Like when a patient is having a ERM, contracted ERM with pucker, the photoreceptors may be close together. So more number of photoreceptors will be stimulated in a particular area and patient will have a macropsia. This is a pincushion effect or a micropsia where like in macular edema, the photoreceptors may be displaced more farther apart. So lesser number of photoreceptors will be stimulated and this will result in micropsia. So this macropsia and macropsia or are both examples of metamorphopsia. And in optic nerve lesions, you may see blurred or missed lines. So this is a part of a central cecal scotoma. And here you can see a part of arcade scotoma coming up in the border of the amsler grid in a glaucoma patient. If you ask what's the most important use of amsler grid, it is in the monitoring of AMD. So a patient can be given a chart to be to do the monitoring at home. It helps in looking for the progression or development of new scotoma or distortion. So when you have a patient with dry AMD, he can be asked periodically to monitor his vision with each eye, giving an amsler grid at home. So if a patient develops a new scotoma or a new distortion, that means it may be a conversion of dry to wet AMD. Also in a patient with a silent or quiescent CNVM, development of a new scotoma or distortion may indicate a new activity or a continuing activity in a CNVM. So it's also useful in other conditions like diabetic macular edema, CSR, as I earlier mentioned, and ERM with pucker, where we can decide on surgery. A patient may be having a 6/6 vision, but documented metamorphopsia may be an indication for ERMP. And in advanced POAG, where the vision loss has encroached central fixation, you may see changes in the amsler grid. And it's also useful in finding out if a patient has macular sparing in patients with hemianopias. So amsler grid, it is a simple clinical perimetric method. It's cheap and freely available to assess central visual field. It is easy to detect and monitor progress of sight-threatening macular conditions with this simple test, and it's a valuable tool for self-assessment.